in Abuja. And most of the times when we hear that, we feel it's overrated. Health is wealth. We hear that every day. When you fall sick, that's when you begin to know the importance of being healthy. Now, people talk about exercising, eating right, and all of that. And we just seem to just ignore it. Let's hope that we're not in a situation where we really need to be healthy and we're down at that point. Well, this month is the month of diabetes. Awareness on diabetes, myths, facts, and everything we need to know about diabetes. And I have a doctor beautifully seated in the studio. Yes, I have Dr. Etsy Kelsey. She's the medical director, Whole Care Health and Wellness Clinic. She's also secretary, Holistic Health and Wellness Initiative. Welcome to the studio, Doctor.
Yeah, thank you for having me here.
All right.
You know, this month being the month for diabetes awareness, it's a great delight to be here because really at this point there's an epidemic of chronic diseases in the world as a whole, you know, but especially for our country, Nigeria.
Okay. Now we'll be having diabetes. We'll be talking about diabetes specifically, understanding what it is, myths, facts, and early warning signs. Now, can you start off by letting us know what exactly, when we talk about diabetes, everybody knows, yes, we've heard about it and we know, you know, that kind of, but do we truly understand what it is?
Okay. So when we talk about diabetes, most people just call it like sugar sickness or something, you know, to the layman. But diabetes is the body's inability to effectively metabolize sugar, you know, just to put it lightly. So one is diagnosed to be diabetic when their fasting blood sugar is about 7 millimoles per liter on above, or there's a test called the oral glucose tolerance test, where 75 grams of glucose is given, and then 2 hours later, your blood sugar is checked to know. Okay, your blood sugar is checked after 2 hours, and when it's about 11.1 millimoles or above, millimoles per liter or above, then one is said to be diabetic. Or also, there's another test called glycated hemoglobin, which is the HbA1c. So if the blood sugar is 6.5% or above, because it checks the average blood sugar in a patient over the last 3 months. So if that is 6.5 or above, one is said to have diabetes.
Thank you for throwing that light, because I've heard someone say, it's not that sickness, diabetes. It's a sickness for the rich people. They're always taking sugar. That is why. I know that's a myth. But is that truly, that's a myth about diabetes, but is sugar truly the reason why people have diabetes?
Okay, that's a very good question. You know, when it comes to diabetes, we have risk factors and there's so much involved, but sugar directly causing diabetes, I'd say that's a no, in as much as it increases your risk for developing diabetes.
Okay.
How? Because with and when I say sugar, you know, this goes beyond just our regular table sugars, because some people say, oh, I don't take sugar. And when they find out they're diabetic, it comes as a shock to them because they're like, but I don't even take sugar. I don't remember the last time I took sugar, or I take honey or something. So whatever we eat, so be it carbohydrate, protein, all of that is broken down to sugar at the end of the day. So be it taking direct sugar. So I just wanted to put that out there concerning sugar. So taking sugar is not what will cause diabetes, but it increases the risk of one developing diabetes because one, it could, one could develop some of the risk factors like being overweight or being obese, which is a risk factor for developing diabetes.
Are there types? Because I hear of type 1 and 2. I wanted to say A and B.
Okay. So when it comes to diabetes, we have type 1 diabetes, we have type 2, we have gestational diabetes, and I'll give a bonus, we have a 1.5, diabetes type 1.5. So for type 1 diabetes, that's just mainly an autoimmune disease where the beta cells of the pancreas is being damaged. You know, it's attacked and it's being damaged. So with that, these patients are insulin dependent. So at this point, they need insulin for them to survive because the beta cells of the pancreas is what produces insulin. So now they don't have insulin, so they have to be given exogenous insulin. So they have to be given those shots for them to survive. Then type 2 diabetes is a metabolic disease, mainly as a result of poor lifestyle choices. So with that, it comes as a result of insulin resistance. So the beta cells of the pancreas is able to produce insulin, But now the body is not able to respond to insulin like it should. So the insulin receptors, so if let's say the blood sugar is elevated, the insulin goes and then it's like knocking on the door. Okay, open up, because there's a transporter that opens up for glucose to go into the cell. So it knocks and it's like, open up, we're here taking glucose. And then there's no response. So then it produces more insulin and produces more insulin. So for type 2, it occurs as a result of insulin resistance. Then gestational diabetes is diabetes that is diagnosed in a pregnant woman, so during pregnancy.
Okay.
Then the 1.5, which is the latent autoimmune diabetes in adults. So it's kind of like, that's why it's 1.5, it's similar to 1. But type 1 diabetes usually happens in, in younger kids. But now the type 1.5 happens in adults because we're seeing more, we're having more autoimmune conditions and autoimmune diseases today. So with that, they're able to develop an autoimmune type of diabetes, which happens in adulthood and not in childhood.
Okay.
So I hope I was able to.
Yes, you did justice to that. So how common is diabetes today in Nigeria? Because I remember growing up, when you hear of a diabetic patient, you would see that the person is elderly. But these days, children are coming down with diabetes. How common is it? I would like you to address how common it is. And does this have to do with our lifestyle? Does there seem to be an increase in the number of people, and especially the age bracket? We didn't used to hear of children, and now we're hearing of children.
Yes, it's really alarming, because when it comes to, remember, diabetes, for the purpose of this, we'll just make it type 1 and type 2. And type 1, we know happens in children, most of the time. And there's an attack on the beta cells, right? So when it comes to type 2, which accounts for about 90 to 95% of diabetes we have today. So when it comes to type 2 diabetes, our lifestyle, yes, has changed, compared to in the past. So back then it was the disease of the rich, but not anymore. So why was it disease of the rich? The rich had, they had cars, they had comfortable homes and seats, they had, their lifestyle was more or less sedentary. They're seated all through. But now we're coming to that point where a lot of society is living that lifestyle. So having those poor lifestyle choices, excuse me, is what has increased the risk for developing diabetes and also increasing the rate of diabetes today. So in Africa as a whole, which I think this numbers, according to the International Diabetes Federation, in Africa, about 25 million persons are said to be diabetic.
25 million?
25 million. 18 million, this is in 2024. 18 million are diabetic or are undiagnosed, right? 18 million. 57 million, they've not been diagnosed yet, but they're more or less insulin resistant. And then the alarming part of it, which I think we should talk about, is 1 in 7 births are exposed to hyperglycemia. So when a woman is pregnant, 1 out of every 7 children given birth to have been exposed to increased glucose in the system. So that is already giving them, that already puts them at risk for developing diabetes in the future. So, but in Nigeria, right now, it's about 7 million, according to I think the United Nations or so. So about 7 million people in Nigeria have diabetes. But I think that's very conservative, though.
Wow. Even at that, I think the numbers are high. 7 million. It's a large number. Well, we'll hold this conversation for now and go on a short break. When we welcome back from that break. Yes, I did promise that my guest will still be in the studio, and yes, she is. All right. So we've been talking about diabetes. Are there signs when this thing is coming, or when I'm infected? What signs should I look out for to know that, it's time to go to the hospital? Or is there a time to go should people just do routine checks?
Okay. Yeah. So when it comes to diabetes, before one is diagnosed as diabetic, they have probably gone through a phase of insulin resistance, which sometimes takes about a decade. So there are certain risk factors. So if anyone knows that, okay, they're at risk for developing diabetes, either as a result of genetic predisposition or having parents who are diabetic or that they're overweight or obese. So for the being overweight or obese, I'd like to pause here because if we're focusing, being overweight or obese is mainly the BMI. So with that BMI, I just want you to know that we have people who are obese based on the BMI scale, but they are metabolically healthy. So they may not be insulin resistant. So we have metabolically healthy obese persons, right? So it doesn't mean because someone is obese, yes, that's a risk factor, but it doesn't mean that automatically they are at risk. But also we have thin on the outside, fat on the inside individuals. So their BMI could be within normal, right? But they have accumulation of fat already around their viscerals. So just to put that, for us to take note of that. So we have, so when one has some of these risk factors, you start gaining weight and it's difficult for you to lose, or you're having things like skin tags, fatigue. So it's something to get checked for, go check it out. And even before you get to that, it says like 45 and above. But now we're seeing that even children are developing type 2 diabetes. Okay. So it's just something to look out for, if one has risk factors. Go to the hospital, get your test done, and yeah.
Let's talk about prevention now. Mm-hmm. So if a person in my family had diabetes, I know that, it's in the family and I can come down with it. Is there a way I can prevent myself from coming down from being diagnosed with diabetes too? Or if we do not have a family history, what do I do to ensure that, I don't ever get it?
Okay. So when it comes to family history and genetic predisposition, sometimes, we may think it's the same thing, but there's a difference. So genetic predisposition is showing that, you have genes to show that, you're at risk for developing diabetes. But when it comes to the family history, as children, we tend to do what our parents did. So a mom makes the same meals. Her children will most likely move on and make the same meals for her family, and then that continues from generation to generation. So that could be the reason. Could it be lifestyle that's causing this, that's making it look like diabetes is there from one generation to the other. So for us to prevent, I already mentioned that insulin resistance predates diabetes. So it's about a decade. The whole process starts about a decade before one is diagnosed with diabetes. So yes, is to, we always talk about eating healthy, right? But what does that even mean? Some people say, let's just eat healthy, let's eat healthy. So to just make it simple, one thing is to avoid our ultra-processed foods. Okay. So ultra-processed foods, let's take that out. Let's incorporate more fruits and vegetables, good protein, good quality fat in our meals. Then our frequency of eating, because the more you eat, the more insulin is being released into the system. So we have to also work on the frequency, in eating. Do not eat when you're not hungry. You don't have to snack in between. You don't have to eat 5 times a day like we're told. Eat 3 times and then 2 snacks in between. That's not necessary. Eat when you're hungry, and then physical activity. So physical activity, it doesn't mean you should go and register in a gym. So just taking out that sedentary lifestyle, trying to stand up and move around at work, maybe an hour after sitting. You've seated for about an hour, stand up, move around, take a walk, do some squats, for 1 minute, 2 minutes before you continue with what you're doing, prioritizing those aerobic exercises, walks, doing strength training, because as I said, muscle is the organ of longevity. So, and it helps with insulin sensitivity too. So yes, those are some of the steps, and then getting checked on time. So there's a test you can do, even if one is not, doesn't have diabetes yet, you can check how insulin resistant you are so that you can take steps to start working backwards instead of, just sitting down, waiting to get the diagnosis of diabetes.
There's so much to talk about, but we do not have time again on the show. Can you tell us how can, in very few words, how can families support their loved ones living with diabetes?
Okay. So when it comes to support, diabetes, first of all, is a very expensive disease condition to manage. So the price of medication keeps soaring. It keeps going higher and higher and higher. So that is one thing that family members can do. So it's unfortunate that I'm bringing finance to the forefront of it. But besides that,
important.
it's very important. Besides that, stress is also a big issue. So having a good, support system, for those with diabetes, getting the right education so that they know how to support them. There are certain things that when one is diabetic or when one has diabetes, they should avoid, so having the whole family member join them. You can't say, do not eat ultra processed foods, do not eat some of these snacks. And then things like vegetable seed oils, those are things that should be taken out too. And then you have it in the house. Or because I'm not diabetic, let's just have it there. So I think it's a disease that should be tackled as a community. So yes, so they need that emotional support, they need that financial support, they need a community to help them in the process, and then even being able to constantly manage their blood sugar. So yes, we have our blood glucose monitors where you have to prick yourself to check your blood sugar. But now we have something called the continuous glucose monitoring system.
Okay.
We have one here.
Okay.
And the continuous glucose monitoring system, you just have a sensor that is installed and it checks your blood sugar every 5 minutes. Every 5 minutes. It sends the information to your phone. So with that, because we're all different, right? So one thing may cause a glucose spike for you and not for me. So with that, you're able to personalize what is good for you and what you should avoid over time. So with that, you also have, you can have the app, the results or that app shared with a loved one, so that when the blood, you're getting these spikes or you're getting the very low levels, which is hypoglycemia, you're able to reach out and say, okay, what's going on with this family member? And then even the government as a whole,
this, the instrument you're telling us about, can you show us?
Yes.
Okay.
So this is the continuous glucose monitoring system. So you just have a very tiny sensor on here. You can take a shower with it. You can, do whatever with it. You don't have to take it out. And you have that on there. So once you eat, you exercise, whatever it is you do, you can see the impacts that food, exercise, stress has on your blood sugar levels.
All right. Thank you so much, Dr. Etsy Kelsey, for giving us an awareness on television this morning. Thank you so much.
Yeah, thank you for having me.
All right.